It is 6:25 a.m. It's been about an hour since I woke up, and today is week 2 of clinicals. So today is Saturday, and I'm supposed to be having my own patient today, which will be very interesting. I'm not actually responsible for too much. It's just doing like vital signs and then head-to-toe assessments. It's just a little bit nerve-wracking since it's the very first patient I'll be having, and also my supervisor will be watching me, so that additional pressure of someone watching you perform tasks is always a bit of a anxiety-inducing thing for me, and I'm sure for lots of other people as well. But yeah, that's pretty much it. And then we don't have too much to be responsible for because we haven't actually learned how to give medications yet. That's in 2 weeks. And also, so me and the rest of the clinical group are meeting up at the hospital at 6:40, and then we're gonna go upstairs together and get changed and be ready to go by 6:50. Darkness is my god. We're actually coming up on light. Oh, and it's raining. Okay, I should probably walk faster so I don't have to get that umbrella. It's definitely getting into Vancouver season. Okay, there's light. Oh my gosh. Okay, let's go. Good afternoon. It is now 1:24. I just got home from clinicals. Couldn't really vlog because I don't know, I was working with patient data the whole time. But it was a good day. Let's see what I did. I got there, I did vitals, and then it was honestly really nerve-wracking just because it was my very first time doing it. And then changed briefs. I charted for the very first time. It was such an interesting experience. We used like professional language, and then just like looked up medications and answered call bells. It was interesting because previously in my hospital placements I was always told like, no, you can't do that, you can't do this, but now I am like the person who's responsible for all of it. It's also now become a very gorgeous day. The clouds are lifting, there's a blue sky, you see the mountains in the distance. It's not the rain that was originally promised for today. Now I'm just going to clean everything with Lysol because with COVID it's kind of dangerous. I'm just gonna wipe everything down with Lysol. Hello, it is now Sunday. It is about 1:30 p.m. I've done such a terrible job of vlogging my clinical days this weekend. So I had clinicals both yesterday and today, and they both started at about 6:50 a.m. Because patient changeover or shift changeover is at 7 a.m. So just got there a little bit earlier to review patient charts and to look at medications. But since I've done such a terrible job with vlogging, I thought I would do a little what's in my nursing clinical placement bag. So yes. Okay, so to start, we have my shoes, which is in a separate bag. It's a little bit wet because it's pouring rain outside as per usual with Vancouver Falls, or pretty much all year round in Vancouver except for the summer. So here are my shoes. They are black leather. Black and white are the protocol for the nursing program, and leather is just so that it's spill proof. If patient fluids such as blood or urine, feces, or anything else gets on it, it's easy to clean. But also with COVID currently, it's like also really nice because then you can wipe down your shoes at the end of every shift so that you don't risk any chance of bringing the virus back home. Okay, so also in my bag, or I guess on my wrist, I have a watch. It has a second hand so that I can count respirations and patient heart rates very easily. I actually got this for very cheap at Shoppers. It was just $10. And it's actually pretty nice. It's just that like it's a little bit loud, but I find it works. It gets the job done. Then I have my water bottle for those long shifts where I am super dehydrated, and also it's just really nice to catch my breath and have a drink of water in between taking care of patients. Now here is my bag. It's unzipped and I have just sanitized it and cleaned it up. So I just got back from my Sunday shift. It was a 7-hour shift. Okay, so let's move aside. this is my food bag. So I just have snacks inside. Inside here was just like cheese crackers, goldfish crackers, have like granola bar, and also I had my lunch, which is now finished, but it was just roasted veggies. And then in a separate pouch, I just have my stethoscope. It is the Littmann Classic 3. Wow, I forgot the name of it for a second. So yeah. And I use this to assess patient breathing sounds and heart rates. And then just have scrubs. They're navy blue and embroidered with the school name and the program, which is nursing. And then we have goggles, which the school provided since it's COVID time, and they just want to keep us safe. However, you don't really need to wear them unless you're dealing with like splashes with a patient, which we haven't really done yet. Here is a folder of different papers. It's mainly just like guidelines and deadlines for different assignments that we have coming up in clinical, as well as like hand washing policies, assisting patients with walking and stuff like that. Okay, so here is like a organizer sheet for our patient, and we basically just put down any interventions that we do, any assessments that we do, diagnoses, so that we can come up with a care plan to take care of our patients properly. And then we have a little notebook. This is what I find the most useful. So I've only taken care of one patient in the past 2 days. So it was the same patient that and I got to keep them, and I got to follow up with them over the past 2 days, which has been really nice because it offers consistency. But essentially I just write down their vital signs, and then my charting I put in here as a draft first, just so I can collect my thoughts before I officially enter them into the charting binder. And then I also note down any concerns that I have at any moment, so that I am able to report to my primary nurse as well as my clinical instructor when the time comes. And then I don't have to worry about memorizing anything because it's all in here. And inside the little notebook, I also have like a little cheat sheet of what vitals I need to take, as well as their normal ranges. Also, a head-to-toe assessment, so that, you know, when I am nervous and stressed and I don't remember how to do them, that I can just look at this cheat sheet and just follow the steps that I have listed for myself. Although, to be honest, when I was super nervous and assessing the first patient yesterday, I still froze up. Anyways, just because the head-to-toe is a little bit different for each patient, and it just depends on their status and what they're in the hospital for. And then just have my hospital badge. And then, so this is a pin light. You can shine it in the patient's eyes and check for their pupil sizes to see if they dilate when you shine the light into them. And also it tells you like how big your pupils were or how much they shrink, and just a scale on that. And then just some 2 black pins, because that is the only color of pins that this hospital that I'm currently placed at accepts. But you know, depending on different hospitals, sometimes they require you to put different vital numbers in different colors. But just double check with what hospital you're working with and what their policies are, because for now it's just black for me. And then I have an extra mask, although the hospital also provides them. And then here is a little booklet from the student society that they give us, which has more like ranges for vital signs, and also how to watch out for different shocks, or what to do for different assessments, and just basically like also just a cheat sheet of things to follow. Very useful, although I haven't really used it yet. So next week we get a new patient, and we keep that patient for the 2 days, and we just again do head-to-toe assessments, vital signs, charting, and then the week after that we get a week off, and after that we're learning medications, we're giving medications. So very exciting. I hope that, you know, this what's in my bag kind of makes up for the fact that I was so terrible at vlogging my clinical days the past 2 days. But honestly, it's been really, like, I have a lot of free time, but it's been really difficult to actually pull out my phone and film anything, just because it's such a huge invasion of privacy, and confidentiality issues are so big in hospitals. And especially as a student, I just don't want to cause any disruptions, or be, you know, just negatively viewed for having my phone on me all the time.